Hello there. Today we're talking with Meyer therapist and author Jeff Vanzant about his latest book, Prayer and Counseling. Jeff, what led you to decide to write a book about prayer and counseling?
Well, it's a topic that a lot of people don't think about. But, a few years ago, I was doing my graduate thesis, and I was shocked to find out that even among Christian counselors, the actual percent of people that incorporate prayer into counseling is pretty low. And while you have like 4 out of 5 Christian counselors who agree with the idea of prayer and counseling, probably only about 16% use it with their clients at any given time. So that leaves a huge opportunity, as I see it, to educate and encourage and actually give a blueprint for how somebody can begin to use prayer in counseling where they, in the past, maybe had the idea or notion but never really had the opportunity or felt like it's something they could take the step and embark on.
Many people have personal stories of answered prayers, but have there been organized attempts to validate the effectiveness of prayer in healing or helping settings?
That's a good question. There have been, and these have been called, well, in the 90s there were over 6 different major prayer studies, and oftentimes these are distant intercessory prayers, where because if you have somebody in the same room, you get a certain amount of just encouragement and psychological effect from that person hearing the prayer. But there's pros and cons with trying to test prayer scientifically. It really, first of all, we know from Scripture that we encourage not to test God, and some people interpret it as that. Although most attempts to validate prayer are not intended to show it as ineffective, but to show it rather as very effective. And so the most famous study of these is a study, it's called the BIRD study, where 329 cardiac patients were tested over 27 different parameters. And it was a triple-blind study, so people prayed for 2 groups, a control group and then a non-prayer group. And over 7 different parameters showed improvement, less intubation, quicker recoveries, and then most of the other parameters showed some improvement as well. 7 were significant statistically. So there you have an example of a distant intercessory prayer study that actually shows that prayer has an effect. However, there's problems with that. That assumes that, well, did the other people who weren't being prayed for, can you really ever have a control group where nobody is being prayed for, and how would you know that? So studies like that have some problems to them. Also, a lot of people from the parapsychology viewpoint have tried to use what they call mental healing or intentional healing in the same format, and it really doesn't give God the glory. So those studies aren't really designed as true prayer studies.
Mm-hmm. I see. Well, why should a therapist be the one to bring up the subject of prayer? Isn't counseling about the client's needs and their agenda?
People who are suffering get a lot of hope from prayer, and if there were no other effect other than that, we know that would be well worth it to initiate that kind of hope, encouragement in somebody else. In fact, when they've done studies, they've shown that the people who do the praying, who do the intercessory prayer for someone else, benefit as much or more as that person from prayer. So that's been something that has been able to be validated. They took a study of people praying 15 minutes over a 3-month period, and they self-reported huge improvements in their overall well-being and outlook by just engaging in that simple activity. So that's one example. The other side is that we live in a culture where there's a huge sea of the spiritual homeless. People don't have a home church. There's been a lot of situations they don't have a group that they belong to. And so when they see a therapist with their problems, that may be the only touch point or point of contact that they have where they can get some spiritual help at the time. And we know that people in institutions, for example, who are getting inpatient help, see a chaplain much less than people in like a medical hospital situation. So again, another situation where people, a therapist has a rare opportunity to intercede for somebody. A lot of times people are just too broken, too ashamed, too wounded to pray for themselves, and they can use that extra step of somebody initiating that on their behalf.
Kind of a forest through the trees when they're coming for help, needing help. It seems like that would maybe be the reason therapists would want to bring that up as compared to somebody even taking the initiative to bring that up for their own benefit.
Right.
How can prayer directly or indirectly aid couples in marriage counseling?
Well, this is a really wonderful area where I know a lot of people who do marriage counseling implement prayer with couples. And the advantage here is that, you know, when you bring in prayer to a couple's situation, you're adding a third tier of relationship. And what people found, they noticed that in the very short order, people start to develop a greater permanence and view of that relationship. Now there's another entity, there's another party involved in the relationship's decisions. So there's also a mindset that of less of, you know, can you fix my partner, and more individual responsibility develops when someone, whether it's, you know, my partner is praying for me or I'm praying with them as a couple. Either way, prayer and counseling with couples has really shown to strengthen and fortify I guess you could call it the cement, the glue of the relationship, and temper things like anger and other problems that can come of conflict in marriages.
How much does prayer in a relationship build maybe an element of teamwork that's not there, or at least aid in that, knowing that they can both be praying about a common thing? Have you noticed that at all?
Sure. It's a wonderful way to take a problem where a lot of times people harbor this hidden agenda that, you know, it's my spouse that's a problem or my partner's a problem, and they transcend that to see here's the problem over here, and we can join together in prayer, a common bond as well as a common endeavor to work on the problem. And you externalize the problem rather than carrying it or pointing fingers and using the blame gun with your partner.